In this video, I want to do a quick walkthrough through our NICU notebook, and this is a notebook designed specifically for nurses working either in the neonatal ICU, the pediatric ICU, a well baby nursing unit, or even a pediatric ICU or pediatric setting. And so it's a 5.5 by 8.5 inch notebook, so it can fit in pretty small location, and it's a 2-page template. So on the left side, we have portions that you're primarily getting for sign out, and then on the right side, it's primarily for information that you're going to be putting as you go along your day. So there's ample room for information for both the patient, the infant, as well as the mother. So it has some past medical history for both the infant and the mother. It has areas for APGAR and kind of the mother's gestation, and then also birth weight, their current weight as time progresses, and some social history or family history. But the reason why this is mainly catered towards the ICU, although it's not strictly for that, is that it's broken down by system. So we have a section for cardiovascular, respiratory, GI, neuro, GU, skin, lines and tubes and drains. And so when you're receiving sign out, typically they're going to be in these certain order, especially in the ICU setting, where it's going to be more of a system-based format as opposed to other situations or other nursing units that you may be on. And so that will just allow it to be a much more easier way to receive the information during sign out and to be able to document in each of these different locations. There's also going to be areas for discharge plan, that these are the plans that you may have for the patient looking forward, and areas for just common things that need to be done before the baby is discharged, things like vaccine, newborn screening, circumcision, lactation consult, hearing. So all just kind of common things that you may encounter when you're on a newborn unit or in the NICU or PICU. So the left side is really catered towards, and it's not strictly meant for this, but the idea is that you receive the information during sign out and you fill out the left side for the patient, and then you kind of can take some more detailed notes, and then as you're going on throughout the day, you have an area for your charting. And so you can do this obviously both in the computer, but some people like to have it as they're going, and then they can kind of enter into the computer as time goes on. You have an area for multiple vital signs that you can be taking, also at least room for 4 to 6 sugar checks that you can do, some common labs, area for labs that you can put in as they come in, some to-do sections so you can kind of remind yourself on things that need to be done throughout the day, and then also for medication. So we have an area for time, the medication that was given, the route, the dose, and then areas where you can kind of fill those in. You can also use it for events as well. And then also on the right side, also for feeding, fluids, urination, and stool. So ample room for that as well. And then a big section for notes. So each template looks exactly the same. As you go throughout the day, you can either see the same patient and use multiple templates for that same patient as you go on, or you can just use, one patient on one page, and then the next page is going to be for another patient that you're seeing, and so on and so forth. So you can kind of use it however you feel. In addition to the notebook, each notebook is going to come with a reference sheet, and this reference sheet is just going to have some common things that you can use while you're on your pediatrics or neonatal nursing care. So this is kind of just a very quick overview, and in other videos we'll kind of compare this notebook versus some other similar nursing notebooks. Be sure to check out medicalbasics.com for more educational resources like our H&P notebook, and don't forget to subscribe to our channel for more tips and lessons.